Hello, and as mentioned, my name is Minal Patel. I'm a director at the Schroeder Institute at Truth Initiative. Today's talk will be on following a moving target, policy issues, and addressing emerging tobacco products. I wanted to share that I have no relevant financial relationships to disclose within the past 24 months. Today, I'm going to really talk about this overview of tobacco products, as well as understanding current tobacco use rates in adults and adolescents, as well as the proliferation in emerging tobacco products. We're also going to be discussing an overview of policies that affect these tobacco-related products, focusing on menthol and youth-centered flavors, as well as identifying gaps and loopholes in current tobacco policy. Finally, I have some recommendations for implications for future policy. So for many of you, you may know that youth tobacco use has been rising in previous years. However, we have good news. Youth cigarette use continues to decline in the United States. Youth e-cigarette use was at an all-time high in 2019, but has decreased since then. However, we still have some concerns. Total tobacco product use, including e-cigarette use, has increased in the United States amongst youth. We still have millions of young people vaping and at risk of addiction and becoming tobacco consumers for life. So when we look at adult smoking prevalence, we see that since 2010, we've had a great decline in smoking prevalence amongst all adults as well as young adults. However, amongst adults, you'll see that we are starting to see a tapering of reduction, and it's plateaued at 14%. Amongst youth, we've seen a great decline in current 30-day smoking from 27% in 1998 to only 3.3% in 2020. Now, if you look at multiple tobacco product use, you see that any tobacco product use was an all-time high in high school students in 2019, and e-cigarettes specifically were at a high of 27.5% of high school students using tobacco products, e-cigarettes, within the last 30 days. We did see a decline to 19.6 in 2020. However, I do want to point out that we are in the middle of an epidemic and a pandemic where adolescents have not been in a traditional high school setting. And many of the ways in which adolescents secure these products is through their peer influences. The reason that we're so interested in e-cigarette use and cigarette use is because nicotine exposure during adolescence is very important, as their brains are not fully developed until the age of 25. Nicotine can harm the developing brain and cause deficits in attention and cognition and mood disorders. E-cigarettes are really our primary source of nicotine for this age group, especially amongst high school students. Since their introduction in 2008, e-cigarettes have become both ubiquitous and an increasing source of public health and policy concern. And now they're starting to threaten the progress that we've had in public health over decades of reducing cigarette use. So we're interested in this specifically because e-cigarettes are now the most commonly used tobacco product in youth and young adults. And 70% of these youth e-cigarette users say they use them because they come in flavors that they like. We also see that young people are more likely to start smoking cigarettes if they're vaping, and that's 7 times more likely. So you may have heard of the first generation e-cigarette, and that was really meant to mimic a cigarette, which you can see in the first picture. However, over time, we're now at the 3rd, 4th generation of e-cigarettes, where we see these sleek devices, and they look very, very different than a traditional cigarette. They're a whole new product unto themselves. E-cigarettes or vapes produce an aerosol by heating a liquid that usually contains nicotine, flavorings, and other chemicals. And they can be harmful when inhaled and potentially have other harmful substances. Some of these common brands are shown here. You may be most familiar with Juul or Puff Bar or Vuse. The Juul influence is really important to understand. This is a product that entered the market in July of 2017. And between July 2017 and October 2018, the number of young adults between 18 to 21 who tried Juul increased more than 400%. And by November of 2018, Juul claimed 2/3 of the total e-cigarette market in the United States. Well, why is this important? Well, first, a jewel pod is equal to about 20 cigarettes worth of nicotine, as they have stated previously on their website. And many individuals who are jewel users didn't know, 63%, that these products contain nicotine. One innovative aspect of Juul is that nicotine salts were developed, and they're a complex compound containing salt-based nicotine. The reason it's important is it's less harsh to vape, which allows for better tolerance of higher nicotine salt e-juice. And every Juul pod contains 3 to 5% of nicotine, which is higher than most products that were previously on the market. And so one Juul pod contains approximately the equivalent of 20 cigarettes worth of nicotine. We really wanted to get an idea of understanding this role of nicotine and Juul specifically, and so we conducted 3 specific studies. The first was to understand Juul use and reasons for initiation among adult tobacco users, but then we wanted to get an idea of the impact of Juul on schools amongst teachers and administrators, as well as understanding parent perceptions of Juul and other e-cigarettes. And what we found was 44% of parents identified a Juul device as an e-cigarette, and while most parents, 96%, had seen or heard of e-cigarettes, only 55.9% had seen or heard of Juul, and only 44% could accurately identify an image of Juul. Now, this is very similar for teachers and administrators, and also relevant for other healthcare providers who definitely are supposed to, be helping this youth group in terms of reducing their tobacco use, but sometimes may not be aware of these products that are emerging on the market. And again, we are concerned about this in the United States because there is a risk for future combustible cigarette use. We know that there is substantial evidence that e-cigarette use increases the risk of ever using combustible tobacco cigarettes amongst youth and young adults in the United States, as said by the Public Health Consequences of E-Cigarettes from the National Academies of Science. Now, it's very important to understand that the climate in the United States is very different than the other countries that may be using e-cigarettes as a harm reduction tool. In the United States, this product has really been for being on the market as a product for any individual who may be interested in nicotine or an alternative to any product that may contain nicotine, including combustible cigarettes. However, in other countries, it's used as a cigarette cessation tool, and that can be very different in terms of the climate of this epidemic of adolescents using in the US, unlike other developed countries. We did a study examining smoking cessation amongst US adults and their use of Juul, e-cigarettes, and other products. And what we really found was that 78.8% of former smokers who quit in the past 4 years, were not at all using any of these products, but really only 3.6% of adult smokers who attempted to quit in the past year used Juul in any combination with other e-cigarettes or nicotine replacement therapy. And so what we're seeing here in the United States is very different. And it's important to understand our political climate and the tobacco policies that are put into place and how they may differ than other countries. But today, I'd really like to focus on tobacco policies as a tool for reducing the harm of tobacco use in adolescents. So some of the policy examples that I'll quickly run through are looking at either restricting e-cigarette flavors, having a low nicotine standard, briefly discussing the PACT Act, and e-cigarette tobacco retail licensing. But there are several other policies that can be put into place that would help restrict the use of tobacco products on the market. And we really want to focus on flavors with e-cigarettes specifically because 97% of youth who vape have reported that they use flavored tobacco products. And 81% of youth who had ever tried tobacco chose flavored tobacco first as their first product. Now, it is beyond just e-cigarettes. So some flavored tobacco products can include hookah, cigars, smokeless products, and e-cigarettes. And flavors are really one of the main drivers of youth tobacco use. So if you look here, there are flavors of many e-cigarettes shown on the very top left. But on the right, we also see very affordable flavors and appealing flavors of cigarillos, which are thin cigars sold in sets of 3 for only 99 cents. And you can get them in fruit punch and raspberry cream. And these are very, very appealing to adolescents. We also are starting to see many smokeless products showing, various flavors coming onto the market. And the other concern about flavors is menthol has been used historically in many cigarette products, especially to those targeting underserved communities, specifically the African American community. And we know that nearly 9 in 10 African Americans use menthol cigarettes of those who smoke. That is very upsetting and disturbing because menthol is also a way to get adolescents to be more interested in using combustible cigarettes. And one of the reasons why it's appealing is because it reduces this harshness of smoke, and it also makes it easier to start, but also harder to quit. And the industry is very well aware of this. And so we have e-cigarette policies that, have been considered, but what we have seen is weak regulation results in weak results. So I'm going to run through a brief history of some of these e-cigarette federal level regulation highlights. In August of 2016, we had a deeming rule that was finalized, making it the first time the FDA had authority to regulate e-cigarettes. And in 2017, they announced that they would, have a regulation plan. The FDA started to crack down on some of this in 2018. And then I'm going to speak a little bit about the 2020 policy. But what we found was there were several gaps in this regulation. So compliance policy is incomplete and doesn't protect kids. We need FDA to review e-cigarettes on the market now, and FDA needs to enforce the law to the fullest. Finally, we need to ban flavors on all tobacco nicotine products, not just e-cigarettes, as well as prohibit the online sale of tobacco products. So here's a story of a policy that had a lot of promise. Most recently, in September of 2019, the Trump administration announced it would remove all flavored e-cigarettes from the market until FDA reviewed them and determined that flavor was appropriate for the protection of public health. This was thrilling news, and speaking as a researcher, also as an advocate, I was really happy to see flavors being removed because adolescents were the ones who were using these most in terms of Juul and other e-cigarettes. And so I put out a survey where we did a national sample of adolescents and young adults who were currently using e-cigarettes and asked them, if flavors were removed from the market, what would you do? Would you stockpile? Would you buy them off the black market? Would you create your own flavors? Would you stop using? Would you, switch to other tobacco products? And there was a lot of promise in these individuals reporting they would probably quit because they weren't so keen on the tobacco flavor of the e-cigarettes. And it wasn't really the nicotine that they were excited about, it was the flavors. However, the nicotine is what kept them going. Unfortunately, it didn't take long for the vaping industry to swoop in, and the administration began walking back on that very strong proposal. And very soon after, Donald Trump, who was in charge at the time, said that, they'd be meeting with representatives of the vaping industry. And what's unfortunate is prior to this, we had a meeting with the president to discuss our results and had shown quite a lot of promise in taking these flavors off the market. And so the final policy that was issued by the FDA on January 2nd, 2020, was looking at prohibiting all flavored closed system cartridges, such as menthol and tobacco flavors. They were no longer exempted from the ban. And so we were able to have flavors like mint and mango off the market, but menthol and tobacco was still kept on the market. And they continue to be sold in all types of e-cigarettes. And additionally, e-liquid flavors for open or refillable systems are still allowed. So it's really the pods that were being regulated. And disposable e-cigarettes of any flavor are still allowed. And there's no restrictions on where these products can be sold. And so here's a graphic representation of what's not allowed and allowed. If you look, Juul was the most popular, so those flavors were not allowed. But Juul actually voluntarily took off some of their flavors from the market prior to the implementation of this policy. However, look at all of the products on the right that are still available. And we see, menthol Juul pods, which are very similar to mint, still on the market. And we see this proliferation of disposables and other flavored products. If you look at the e-juice in the center, it really is highlighting gummy bears, which is very appealing to youth and less so to adult smokers who may be trying to quit e-cigarettes. And so going beyond Juul, we see that disposable vapes are now becoming more popular. So under this new federal policy regulating e-cigarettes, non-pod based e-cigarettes such as puff bars were exempt, creating this federal loophole for flavored e-cigarettes. And these disposable e-cigarettes use a very similar nicotine salt formulation for high and effective nicotine delivery. And so what have we seen? A rise of disposable e-cigarettes since this policy has been put into place, specifically for puff bar. So during 2019 to 2020, disposable e-cigarette use has increased over 1,000% among high schoolers and current e-cigarette users, and approximately 400% among middle schoolers. So puff bar is now the most popular disposable e-cigarette among young people. And in very many cases, people are saying it's now quickly becoming the new Juul. But we need to go beyond just puff bar and all of these products. We're constantly targeting new products coming onto the market. And these vaping flavor bans have paved the road for new oral tobacco products, or OTP. And they come in various different flavors. And so these products are for both snus and other flavored products that you keep in your mouth. And many times they say they're tobacco free because they just have the nicotine and they don't have the tobacco leaf in it. And it comes right now in several flavors, including mint and citrus. To get a little bit more of the idea of it, sometimes there is synthetic nicotine in these, which is not regulated by the FDA Center for Tobacco Products, or they have nicotine derived from tobacco leaf, but without the leaf itself. And they're in more acceptable formats, such as lozenges, pouches, discs, and gum. And this is more socially acceptable than traditional smokeless tobacco, where individuals would be spitting out the tobacco at some point. But this is concerning because it's now being targeted towards a younger and alternative audience rather than the traditional smokeless tobacco product market. In the interest of time, I won't get too much into these next few policies, but I did want to acknowledge that there are many other policy approaches. So one of the approaches that was mentioned a few years back was potentially having a low nicotine standard for combustible cigarettes. And now this product idea of policing the amount of nicotine in cigarettes has now been potentially proposed to be having a low nicotine standard in e-cigarettes as well. And the reason that we want to take a look at this is understanding, what do individuals actually know about nicotine and the health harms, and understanding the behavioral predictions. So you can read more about this in a paper that's referenced below. We also have the PACT Act, which is very important right now given the use of selling e-cigarettes on the market. And we see that they're being sold online. And so generally this would prohibit cigarettes and smokeless products from being sent through the mail. And this is something that will hopefully go into effect soon. Finally, there are ways to have e-cigarette tobacco retail licensing laws. And if you look at this, you see that in the United States, there are several states that do have TRL laws for e-cigarettes, and these laws can create structures for better enforcement and regulation of tobacco products, specifically of e-cigarettes. But we also have other policies that may actually be helpful in conjunction with that, such as restricting sales to minors under the age of 21, which is now a federal policy. So what are the future implications of this? Well, we really need more federal action. And here's what we think. that the FDA should be doing. They should be removing any products that don't comply off the market immediately. They shouldn't really be allowed on the market while they're assessing whether these products are safe or, whether they're helpful, et cetera, whether they have a potential to reduce harm. They should just be off the market. We need to extend marketing restrictions on cigarettes to e-cigarettes, so sponsors and self-service access and free gifts with purchase are no longer allowed. We need to restrict digital and social media marketing. There is a huge loophole that allows companies to unofficially market through social media and through influencers. And that is very dangerous for the group of individuals, adolescents and young adults who tend to use these social marketing platforms. We need to prohibit all non-face-to-face sales, including on internet sales, prohibit the sale of all flavors in all e-cigarette products, but really all products. Menthol should not be on the market because we know the disparities that it leads to. We need to require child-resistant packaging, restrict nicotine levels in e-cigarettes, develop nicotine cessation interventions, and fund research to better understand e-cigarette harms. There is hope. There are local policies that are leading this way. And as of March 31st of 2020, 293 jurisdictions had some type of restriction on flavored tobacco products, and that has only increased in the past year. And so local and state action gain momentum to address regulatory gaps and reduce availability and appeal for flavored tobacco products to youth and young adults. And so we need state and local action. They don't need to wait for the FDA to act. And what they can and should do is require all e-cigarette retailers to be licensed, prohibit the sale of all flavors in tobacco products, including e-cigarettes, and require e-cigarettes to be subject to clean indoor air laws. But really, it's this combination of multiple policies that's needed to reduce this use of tobacco products, and especially the fact that these products continue to change. It's not about Juul, it's not about Puff Bar. It's really about understanding these emerging products and how we can use policy to reduce the burden of tobacco on adolescents and young adults. Thank you.